Last June, I have the great honor to kick off the More Than a Mother campaign in Kenya, in Nairobi. And this was part of the Merck's Capacity Advancement Program, the CAP that we have in Africa, that is making me extremely proud. This is a very, very important initiative for Merck, as we are a leading company worldwide in fertility management. And actually, this is even more important for me personally, as a physician and also as a woman. More Than a Mother is all about reducing the harsh social suffering of infertile women in Africa. And this is a clear healthcare priority, and I would say is an international human rights priority from an ethical perspective. One major aspect of More Than a Mother is our intention to help decrease the rate of sexually transmissible diseases that cause the majority of infertility cases in Africa, as we also address other causes. And this is another clear emergency, and here a lot can be achieved through better awareness and through more active education of the young population and the girls. While I was in Nairobi, I met some of the many barren wives who told me about their personal stories of being ostracized, beaten, abandoned, criticized, simply because they couldn't actually bring a family because they were infertile. And this was not about isolated cases amongst the least favored social classes, but I'm talking about women from very well-educated societies, including senior executives, government officials, and members of parliament. If we are not able to help our local partners, healthcare professionals, academia, NGOs, etc., I think nobody else will. So while I was in Nairobi, I have the pleasure to meet the governor of Nairobi because he was there with us during the launch of this event, and we were together at one of the largest hospitals in Kenya. I think he really praised Merck in very high terms, acknowledging that despite a minor fraction of our top-line revenues coming from Africa, we have not hesitated to fight for African patients. And this is what is making me so proud. And this is, to a certain extent, to a great extent, I would say, what is making Merck so different and unique. I would really like to take 1 minute to acknowledge the team on the ground, Rasha Keleg, and others working with her who makes this all possible. Because I know this program couldn't have been done without their passion to really do more for patients in Africa. More Than a Mother is now getting tremendous traction in Kenya, and we are aiming to roll it out in the future in other African countries, and why not in other continents as well.